Finding puddles of urine around the house is no fun, especially if it stained that new carpet you just bought. And although we can easily get upset and sometimes even angry with our dogs, we first need to try and understand why it is that our dog is urinating inappropriately. So in this video, I will explain exactly what the clinical signs, causes, diagnosis, treatment and prevention methods for urinary incontinence in dogs are, so that you can have a better idea of why it is that your dog is leaking all the time. Hey guys, Dogtor. I'm a veterinarian from South Africa. Now, urinary incontinence is the involuntary leakage of urine from the bladder. Basically meaning that the dog has absolutely no control of when and how much it wants to pee. You will often notice urine in places where the pet is resting, such as in their bed or on the couch, and it tends to be a rather large puddle. Now, apart from the undesired puddle of urine on the carpet, you may also notice moist, yellowish, discolored hair on the dog's lower abdominal area or between the rear legs, typically around the dog's prepuce or vulva. You may also notice inflammation and redness of the skin around the genitals and an increase in frequency of licking at the genitals, especially in female dogs. Now, your dog's urinary incontinence may either be due to a behavioral issue or an actual medical condition, and we'll have a quick look at both of these. The most common medical causes of urinary incontinence in dogs are: number 1, urinary tract infections, which will cause inflammation and irritation inside the bladder wall, causing the dog to leak urine. Number 2, uroliths or bladder stones. Now, if these guys are left untreated and the bladder stones blocks the urethra, therefore preventing the dog to empty its bladder, the bladder may get so large that the back pressure of urine in the bladder will force some of the urine to leak out around the blockage. This is caused by overflow incontinence when the bladder pressure exceeds the urethral sphincter tone. Now, this can become fatal within 3 days if left untreated. Number 3, excessive drinking of water, which can be caused by more serious diseases such as diabetes mellitus, diabetes insipidus, Cushing's disease, and kidney failure. Number 4, obesity. Number 5, spinal cord disease or damage such as inflammation, trauma, pain, vertebral abnormalities, paralysis, or cancer. Number 6, ectopic ureters, which is basically a physical defect in the tubes that carry urine from the kidney to the bladder, usually found in younger dogs. And number 7, a weakened bladder sphincter, which we medically refer to as urethral sphincter mechanism incompetence. This is the most common cause of urinary incontinence in spayed female dogs, and it is believed to be caused by lower estrogen levels that can lead to a loss of muscle tone in the urethra, causing it to not work as effectively. Now, it is important to know that some dogs may have full control of their bladders, but will still urinate inappropriately, usually due to some sort of behavioral issue. Now, these can include, number 1, submissive or excitement urination. This is usually when a dog urinates only a small amount of urine and often happens when he is near a person or when excited about an event, such as going for a walk. Number 2, lack of proper house training. Some dogs may not have been properly trained to eliminate inappropriate spots, and you will often find a normal amount of urine, but this tends to be near a door or somewhere away from where the dog eats, sleeps and plays. Number 3, cognitive changes. Now, some older dogs can experience cognitive changes, which kind of alters their ability to recognize appropriate places to urinate. You will often then see normal amounts of urines in any place around the house. And number 4, pain. If a dog is in severe pain, he may have difficulty moving to the correct location to urinate. You will often notice him dripping urine as he tries to make his way outside. Now, your vet will start off with a full history, and you might expect questions such as: does your dog drink more water than usual? Does the dog show any pain when urinating? How long has it been going on for? How often it happens? How much urine leaks every time? And where in the house you've noticed the leaked urine. He will then continue to perform a full physical and neurological examination where he will specifically feel the size of the bladder and how easy it is to express. He may also opt to run a couple of different diagnostic tests, such as a urinalysis or urine culture that may indicate a urinary tract infection, blood tests that can rule out any underlying cause such as diabetes, Cushing's or kidney failure, x-rays to rule out bladder stones, and an ultrasound or cystoscope to look for tumors or growths within the bladder wall. Now the treatment will depend on the underlying cause. With a urinary tract infection, your vet may prescribe antibiotics based on the results of the urine culture. With bladder stones, a diet modification with some medication to acidify the urine might help some stones such as struvite, but with other stones such as calcium oxalate, the stone will need to be removed surgically, and in either case, the dog may also be put on pain meds as well. With ectopic ureters, the best option will be to surgically correct it. If any endocrinal disease is diagnosed, then the best will be to correct the primary condition, as this will often resolve the incontinence as well. If the cause is neurological, meaning the nerves that innervate the bladder is damaged, causing the bladder to get overfull and therefore to overextend, your vet may prescribe medication such as prazofen or phenoxybenzamine to relax the internal urethral sphincter, diazepam to relax the external sphincter, and bethanical to help improve the bladder's ability to contract. Now, if your dog suffers from a weakened bladder, meaning the muscles and sphincters in the bladder and urethra is not strong enough to contain the urine, causing it to leak out, then there are a couple of other things that we can try. Your vet may prescribe phenylpropanolamine to increase the urethral sphincter tone to help control the flow of urine, and Incurine, which is a form of estrogen in females and testosterone in males, to help increase the number and sensitivity of the receptors in the urethra, therefore increasing the resting muscle tone of the urethra. Now this is important. The dog will need to come back for frequent urine and blood tests to monitor the effect of these drugs, as they can have some mild side effects when used over a long period of time. Now, if the dog's inappropriate urine marking is due to some sort of behavioral issue, then behavior modification by behavioral specialist would be the best way forward. And as mentioned earlier, if your dog suffers from any physical defect such as an ectopic ureter, then we can consider surgery where the ectopic ureter is physically moved back to its normal location in the bladder, called a Colpo's suspension, or we can try the injection of bulking agents such as collagen into the urethra or stem cell therapy. Now, these procedures are usually only performed by specialists though. Now, an effective way to help manage the cleanliness is to get your dog some dog diapers that will prevent the urine from dripping on the floor. Just be careful, as a prolonged moist environment can cause urine scalding and skin infections. So make sure to change its diaper frequently and keep the area around the prepuce or vulva clean and dry. You can also use waterproof pads under their bedding to prevent the urine from soaking into the carpet. Now, unfortunately, there are currently no known methods for the prevention of urinary incontinence, although maintaining a proper ideal body weight will prevent obesity, which will not only lower the dog's chances of developing urinary incontinence, but also a long list of other dangerous conditions. Now, dealing with a dog that has urinary incontinence can become quite frustrating when you need to continuously clean up the dog pee in the house, and this can often result in misplaced anger towards the pet. But in general, many dogs do respond really well to therapy and often enjoy a good quality of life. Some of the meds may need to be given lifelong to your dog, and because of this, it is important to take your dog back to the vet for follow-ups to see if the dose remains effective. Thank you for watching this video. If you found this content to be helpful, I would really appreciate it if you can leave a like on this video, share it with your friends and your family, and if you are new to my channel, consider subscribing, as I'll be posting new videos on interesting pet-related topics every week. And as always, have a lucky day, and I'll see you in another video next week. Cheers!